Hi, I'm Dr. Jeff Witty, orthopedic surgeon and sports medicine specialist at North Oaks Orthopedic Specialty Center.
Hey guys, I'm the head athletic trainer and supervisor for North Oaks Sports Medicine.
And we're here today to talk about different types of shoulder injuries and those types of things.
Yeah guys, it's springtime. All of our overhead sports are well into swing. This is the time where we see an uptick in shoulder, elbow injuries, and we just want to make sure that if you're experiencing any type of problems with your elbow, with your shoulder, we want to make sure that you come in and let us take a look at it to where we can get you back on the field as quick as we can. Dr. Witty and I are going to go through a few scenarios with you, just if you're feeling any types of these problems. These are the things that are going to warrant you coming in to let us take a look.
Yeah, definitely. Thanks, Matt. So there are a lot of symptoms that can happen in an athlete's shoulder, whether you play baseball, you play tennis, or anything like that. And some of these symptoms that you probably need to pay attention to are popping, catching in the shoulder or even in the elbow, any of those things that cause pain. One of the big things that we see in a lot of athletes are actually the loss of their velocity, their speed when they pitch, the speed when they serve, and the loss of control when they do those things. They just can't hit the strike zone, they're missing their serves, and those types of issues. We mentioned loss of motion of the shoulder, can't get the arm up overhead, can't get the elbow straight or bend it because of pain or catching or anything like that. And certainly any numbness that runs down into the hand is a concern, and any swelling of the shoulder or the elbow is also something we probably need to take a look at.
We have a few questions for you guys. So Dr. Witty, we have a question from somebody that plays tennis regularly and now it hurts when she's going to serve. What could that mean?
Yeah, so a lot of that depends on how the pain started. Did it start all of a sudden? Is it something that's sort of gradually been beginning to bother the patient? The other issue is where in the shoulder are you having the pain? Is it the front, back, on the top? Is it just kind of all over the place? Is it associated with any numbness down the hand? And is the pain affecting your sport? Are you unable to win matches? Or are you unable to play the way you want to play? And all these things factor into what we want to do. Is it something that needs just a little bit of rehab, a little anti-inflammatory medicine, or something that we need to image with an MRI? Those types of things we can straighten out in the clinic.
We have another question. Travel ball tournament. My son is a pitcher and he plays pretty much every weekend and we're practicing all the time. He's a pitcher, and then after last week's tournament, he's struggling lifting his arm. What could that mean? And then as a mom, what do I need to be on the lookout for? And what should I tell the coaches as well?
Yeah, sure. Is that directed at Matt? Or? Okay,
Well, actually with this one, this is one we see pretty often when it comes to our younger athletes. These kids are out there every day throwing with dad in the backyard and then going out and playing games all weekend. And really what we find with them is, their bodies are growing and their arm is just trying to catch up to all the activity that they're doing. And, if this is something that's lasting longer than a couple of days or just not getting any better, then certainly this is something that we want to come in so that we can take a look at it. Certainly, we try to ice and do conservative things at home, but ultimately if they're still having trouble raising their arm up, if they're still having a lot of pain, it's trouble sleeping, things of that sort, then we want you to certainly come in and let us take a look at that. The overuse injuries are just very common in these kids. We certainly want to work to get them stronger and get them used to playing these sports with the high demand that they are. So it's one of those things where, if you're having these issues after a long weekend or after, a few tournaments, then certainly try the conservative measures at home. But after that, it's certainly something that we want to take a look at if it's not getting any better.
Yeah, and I'll just add to that. One thing we see is some of these injuries will kind of drag out with time and people just want to ignore it and maybe pretend it's not really there. But what ends up happening is it drags out the problem and it ends up creating an issue longer throughout the season. And so you have an athlete who's not participating and functioning at the level that they would like to. And so if we can get treatment sooner, we can often get people back to their level of performance quicker.
So, because typically we'll have the issues where the kids just want to wait and hope that it gets better,
Right.
And now we've spent over a month hoping that it gets better, and it's still not any better when, we could have come in a long time ago and gotten the ball rolling with getting it treated properly.
Definitely.
At any point, do any of these injuries ever lead to surgery? And if so, what does that look like?
They certainly can, but I would say the vast majority of these injuries are treated very successfully without surgery. Rehabilitation maybe a brief course of some anti-inflammatories, icing, these types of things that Matt just pointed out to us. And the trainers have a really significant role in helping our athletes get back to sport at 100%. They come to clinic, we diagnose what's going on, and then we set out a treatment plan. And unfortunately, sometimes that does involve surgery, but the majority of times it does not. And that's where our training staff, our physical therapy staff are really essential to get everybody back.
So how does the sports medicine team work together with you, Dr. Witty, as a sports medicine specialist? How do you work with the athletic trainers, and how do the athletic trainers work with you?
Yeah, that's a great question. People often wonder, how that dynamic works. And Matt, I'd love to hear from Matt's side. But honestly, Matt and his team are on the front lines of all this. When an athlete goes down, they're right there on the sideline or wherever it may be. They're diagnosing the problem. They're making sure that somebody, if they need to go to the ER or anything like that, that they get there promptly, and they're really sort of at the forefront of getting these kids rehabbed. They spend more time with the kids than I do. They know the kids, know the athlete. They know their personalities, and they're just really essential. And we communicate a lot, over the phone. We communicate treatment plans back and forth. He'll talk to me and say, "Hey Doc, what do you think about adding this?" And I'll think, that's a great idea and think of. And so it's just a great team that I feel gets. It's just that extra level that gets athletes to where they want to be.
Sure, most people, whenever they go to the doctor, they go in, they see them, and then they won't see them for, say, a week, 2 weeks, 3 weeks for a follow-up. And with the communication that he and I share, along with our other doctors and our great physical therapist, we're all on the same page with working together each day to make sure that we're getting the athlete back as fast as we can. So whereas you may have some people that will just go to therapy, say, twice a week, and then the rest of the time, that's it. They're working with us every day. That they're not in a physical therapy clinic working with physical therapy. So it's a very combined group effort between all of our specialties to just basically get the athlete back on the field as quick as we can.
In sport-specific stuff, the trainers have a unique ability to do sport-specific rehab with these athletes. You have a baseball player. A baseball player doesn't need to do powerlifting rehab. They need to do baseball-type rehab, and that's where the trainers are great. Well, anyway, so I guess that's wrapping it up,
Yep,
huh?
they're giving us the cue.
They're giving us the cue. So thanks for tuning in. Hopefully we were able to answer some questions. Really appreciate Matt coming out, our head athletic trainer. And if you're experiencing any of these problems, be sure to give us a call. The phone number is 985-230-BONE. We have offices in Hammond and Livingston Parish.
Yes, indeed. We hope you guys enjoy this spring day. Enjoy the rest of your spring and stay healthy. Thank you.
Thank you.